COVID-19 has had a devastating impact on people who live and work in nursing homes. More than half of the state's deaths have come from long-term care facilities, and some are concerned about the impact this winter will have. WRTV Investigates Kara Kenny found some families who lost loved ones, as they're left wishing more could have been done to protect them from the virus.
More than 2,500 nursing home residents across the state of Indiana have died from COVID-19, including 18 here at Ben-Hur. These are the numbers from the state's database, but each one represents a loved one that a family member will no longer talk to.
This is the last thing that I made for my mom. I wanted her to have something beautiful and special for her at her funeral.
Mary Johnson has a little piece of her mom at home. Martha McCullough died May 16th at the age of 77 after developing COVID-19 at Ben-Hur, a nursing home and rehab facility in Crawfordsville. How much do you miss your mom?
Very much. It's rough. I promised my dad I'd take care of her before he passed away, and he just passed away in 2019. And then they closed us down, and I couldn't get in.
Nursing homes were closed to visitors during the early months of the pandemic. Mary was able to say goodbye to her mom in person at the hospital 2 days before she died.
It's a memory I'll have forever. She took her hand and she grabbed mine and she pulled it down to here and took her other hand and wrapped it around me. She knew I was there, and it's the first time from March.
Janice Ford didn't get that chance. She had to say goodbye to her brother Charles England over the phone as he lay dying at the hospital from COVID-19.
He told me he loved me, but it was almost, so light that I couldn't hardly hear him. He was so weak by that point.
Charles England also got COVID-19 at Ben-Hur and died May 22nd.
It's hard to know that he didn't have to die. Sorry. He didn't have to die.
Janice and Mary feel the nursing home didn't have adequate infection control procedures in place at the time. The Indiana Healthcare Association, which represents many Indiana nursing homes, says in the spring, facilities were not well equipped with N95 masks and other supplies.
I think what we're going to see is a lot of the tragic loss of life that occurred early on in the pandemic. And that was when the country was caught somewhat flat-footed, and prioritization of PPE and testing just wasn't with long-term care at that point.
It wasn't until July that the state started testing all nursing home workers for COVID-19. In August, the federal government sent antigen testing machines to Indiana nursing homes, allowing them to do frequent testing of residents and workers. And it wasn't until November the state sent in the National Guard to help nursing homes plagued with understaffing. Transparency was a problem, too. For months at the start of the pandemic, WRTV Investigates requested data showing where people were dying in nursing homes, but the state told us no.
We don't have a cumulative list of every facility, all of their cases, and all of their deaths.
It wasn't until July they changed their mind.
We are going to report facility-specific COVID-19 data.
AARP Indiana was one of the groups that pushed hard for the state to release nursing home COVID-19 data broken down by facility. Information scarce at the start of the pandemic is now readily available on the state's website.
Definitely encouraged that we got there eventually. That definitely empowers folks to be able to look at the data themselves and help them make decisions.
AARP Indiana State Director Sarah Waddle is concerned about the impact winter will have on nursing homes.
There hasn't really been a comprehensive plan from the state to address virtual visitation, which is going to be absolutely needed over these cold months.
Plus, the National Guard is expected to leave nursing homes on December 31st.
What happens when we don't have the National Guard in the facilities anymore, or the extra bodies?
WRTV Investigates requested on-camera interviews with Governor Eric Holcomb and the State Health Commissioner Chris Box to talk about long-term care, but no one responded to our request. American Senior Communities, which operates Ben-Hur, tells us they are testing 100% of residents in any facilities where there is reason to suspect a resident or staff member may be COVID-19 positive. ASC is also testing 100% of residents in facilities located in high-risk regions, even those with no known COVID-19 contact. All staff members are tested weekly at a minimum, with staff at some facilities tested twice weekly. As nursing home deaths continue to rise, a reflection of increased community spread, Janice Ford and Mary Johnson want you to know that each death is important.
These people are somebody's family, and people do love them. And they had families that they loved, and I don't know, how could you just throw away somebody?
Mary struggles with her own health issues and guilt over not being able to care for her mom.
It's the last thing I'll ever be able to make for her, but it's beautiful like she was.
Working for you, Kara Kenny, WRTV.
American Senior Communities started releasing COVID-19 data before the state required it. ASC also tells us, quote, "We are deeply saddened whenever a resident or staff member becomes infected, and we grieve for each resident who has passed away. As residents begin to recover, we remain steadfast in protecting and continuing to serve them." And the company points out they also do point of care POC machine testing at all facilities. POC testing began in September, and they are averaging more than 60,000 tests per month.